In myofascial pain syndrome, overloading of the musculature leads to the formation of trigger points. It is now generally assumed that myofascial trigger points are the main causes of pain and functional disorders of the locomotor system. Focused shockwave therapy enables an effective treatment of trigger points. With its precise focal point, the piezo shockwave is able to locate trigger points and referred pain. Even deep trigger points can be precisely diagnosed and treated. Most patients complain about pain that has been present for a long time. Myofascial trigger points change the elasticity and strength of the muscles and thus lead to complex functional disorders. Patients sometimes show significant deficits in the mobility, strength and coordination tests. The affected structures must be identified and considered in the treatment. Positioning depends on the location of the affected area. If possible, it should always be selected so that the therapy source rests with its own weight on the patient. This allows a stable and precise positioning of the therapy source during the treatment. The previous diagnostic workup identifies the target structure and determines the treatment parameters. Penetration depth depends on the findings. Frequency setting 6 to 8 Hz. Treatment intensity, total energy flux density 0.05 to 0.35 mJ per square millimeter. Number of pulses approximately 2000 to 4000, 300 to 400 pulses per trigger point. Treatment frequency once or twice a week. Number of treatment sessions 3 to 8 sessions in total. As work is often carried out over large areas across several muscle groups, the therapy source with the linear focus is suitable. With its large focus volume, trigger points can be quickly detected and treated. The point-focused therapy source, on the other hand, has a precise focus with which the trigger points can be diagnosed and treated exactly. It is particularly suitable for the treatment of deep-seated trigger points. Tip: marks should be placed on the skin to identify trigger points detected on palpation, as this makes it easier to find them again when positioning the therapy source.